Can you say a little bit more about what counselling would typically involve?
Yeah, it's a really excellent question. And I think as with any good counselling, as with any good therapeutic approach, there isn't a one size fits all way of working with with somebody. It very much will involve the counsellor or the therapist getting to know who you are, a bit about how mythomania affects your life, maybe looking at the triggers. But some typical things that could be involved might involve things like what we would refer to as psychoeducation. So the counsellor providing some level of education about the condition, about mythomania, including its symptoms, its causes, the impact on mental health, the impact on relationships, and helping the individual just gain some insight into the condition. And that can just be really helpful in terms of reducing feelings of shame, feelings of stigma that might be associated with it. There might be something around exploring underlying factors. So, counseling and therapy can often focus on exploring the underlying psychological factor that contributes to mythomania, such as low self-esteem, a need for attention, unresolved trauma, those things that we've talked about. Um, and through that exploration, through that self-reflection, the individual can just gain insight into the root causes of why they engage in that pattern of behavior. Often therapeutic approaches like cognitive behavioral therapy, CBT, might play a part. Um, and CBT techniques can often be used to challenge distorted thinking patterns and replace maladaptive behaviors with helping with healthier coping strategies and behaviors.